It's so nice to meet you. Dr. Mer, head of gynecology.
I'm Dr. Mahari. I
Dr.
specialize in gene therapy.
Dr. Liam, I specialize in prenatal care.
Really great to meet you. So today we're dealing with Santana. Olivia, want to go over the stats?
Sure. Okay, so she's a 40-year-old woman trying to conceive a baby. Her blood type is B positive, no allergies, and her BP is 120/80 the last time we checked.
She hasn't had any illnesses within the past 3 months. Nothing really we should know about. She hasn't traveled anywhere, nowhere in the Caribbean or Latin America.
Sounds good.
So we're just going to send her and her partner down to the lab to get some blood and tissue work done.
And then I'm going to tell Shannon, our head receptionist, just to book an appointment for her to see me in 2 weeks' time, and then we'll have another meeting again.
Sounds good.
Good. So we got those lab results back, and blood work's good. Just a little bit of alarming stuff with the tissue work. So basically, this is a healthy uterus. We see the lining's intact, ovaries are intact, everything's good. But in Santana's case, she's a case of endometriosis. So what that is, some of the lining, the inner lining of the uterus is growing on the outside, which is creating an infection, which is why she was definitely having those pains in her abdomen. So I think the best form of treatment to go around this would be IVF. She can have a kid, it'll be done in the fastest, quickest way possible. So there's 5 stages. First stage, we're gonna give her some suppressants, just regular prescription drugs basically, and it's going to slow down her estrogen, just lower it, and it's going to replace her menstruation cycle with an artificial one. During the second stage, we're going to set her ovaries into hyperstimulation, so she's going to be producing about triple the amount of eggs that she normally would. During the third stage, though, is when we are going to trigger her menstruation cycle. So those eggs that were being produced will be let into her womb, and then during the fourth stage, we're going to give her some local anesthetic and retrieve those eggs, basically harvest those eggs that have been released and put them with her husband's sperm. And then during that stage, we're going to use ultrasonography just to go in there, take some pictures, use it for guidance, just to really get as many eggs as we can. During the fifth stage, we are going to put her eggs and her husband's sperm together and let it rest in an incubator for about 24 to 48 hours, and the embryo should start to form. And then we place them in her, and nature should take its course from there.
That sounds great. But is there any ethical issues that she might bring up?
If she's uncomfortable with unnatural conceiving, then that might be something that we might have to talk to her about. But other than that, it's pretty normal, pretty natural. That's really it.
Okay, sounds good.
Yeah.
See you guys in 6 months.
Hello, nice to see you again.
Yeah, it's good to see you.
So she's finally pregnant, good news. Now my job is just to offer some genetic screening just to be safe. These tests are important if we think the baby may have any chances of chromosomal disorders.
Mm-hmm.
Since her age does play a big factor in this, I have to offer the invasive and non-invasive procedures.
So you're looking at the baby's genes?
Yes, genetic screening is a series of tests, blood tests and ultrasounds that look at the DNA of the baby. By looking at the DNA, we can see if the arrangement of chromosomes are linked to any conditions like Down syndrome or cystic fibrosis.
Is there any risk or issues with this?
No, these tests are non-invasive, only blood tests. The only problem is that these tests only indicate possible problems and are not 100% diagnostics. That is why I have to offer the amniocentesis and
So what are the risks? Are they worth it?
these risks are much larger than the other ones. There's risk of miscarriage, leaking amniotic fluid, needle injury, and infection. But these chances are very slim, less than 6%, and you're in very good hands.
What is the procedure?
The procedure itself is very simple. All I have to do is use an ultrasound to guide the needle through the uterus into the amniotic sac, where I would take a sample and then test it in the lab. Or in this one, I would just insert a catheter and then take a sample of her placenta to test.
What do you think they'll take to get the results back?
About 10 to 14 days.
Not long at all.
Yeah. The only thing is that there are some ethical issues, and this will create uncertainties if the results do come back positive. The dilemma involves the decision to continue or end the pregnancy. So that's the only problem. But yeah, that's it. So we'll see you guys in 2 weeks.
Okay. Hi guys.
Hi. 2 weeks it's been.
I know.
Crazy long.
So we got her lab results back, and unfortunately, her baby has mitochondrial disease.
Oh no.
What is that?
I think I've heard of it, but
Mitochondrial disease is a group of disorders caused by failure of the mitochondria, which is the organelle that generates up to 90% of the cells in our body.
Oh, so will that hurt the baby?
Well, yes, but only if left untreated. This disease can also lead to disorders such as diabetes, degeneration of the nerves, and even blindness. Unfortunately, her child may not even be able to survive past her teenage years.
So do you have a plan for this?
Well, this disease is a bit of a complex disease to treat, so the options for treatment are limited. Luckily, here at Grace Sloan Memorial Hospital, we have a clinical trial running called gene therapy, which just happens to be my specialty. Although, this does happen to be a risky treatment, so another option would be for the baby to live with the disease and get the proper treatment to decrease the chances of them getting like one of the disorders.
So what is gene therapy?
Well, gene therapy is an experimental technique that's used to prevent or cure many genetic diseases, such as cystic fibrosis, heart disease, AIDS, cancer, or even mitochondrial disease in this baby's case. Well, even though this is a pretty amazing thing, it's really expensive.
I spoke to the parents and they said they're willing to pay anything to have a child. So
Oh, okay.
So how does that work?
So as you can see in this picture right here, the process is quite simple. Since mitochondrial DNA comes from the mother of the baby, we would have to replace the baby's nucleus with one from the mother's egg cells. But this normally wouldn't work alone. So we would genetically engineer the mother's genes into a carrier called an adenovirus, which will then deliver the genes to the cell. And then we would do this through injection or intravenously. Then we would turn the cell back into the baby's body.
Oh, makes sense.
Okay, so Dr. Liam, can you please get the parents' consent?
Yeah, of course. I'll be right back. Okay, so the parents decided to go ahead with gene therapy.
Great. Okay, so the process could be started in a week or so. But first, we'll need to get the parents to sign some consent forms. This is a clinical trial, so that means that they are aware that this could lead to miscarriage or the treatment may not work.
Alright, so we better get started right away.
exciting stuff.
3 months later, Santana delivered a healthy baby thanks to Grace Salone Memorial.